Hello everyone, and welcome to the Academy of Online Radiology Education blog. My name is Dina Ramadan, and I'm an incoming postdoctoral research fellow at Massachusetts General Hospital. Today, we'll explore the role of artificial intelligence in the detection of cerebral artery aneurysms, focusing mainly on its impact on diagnostic accuracy, radiologists' workflow, and the prediction of clinical complications. So, to start, a cerebral aneurysm is an abnormal dilatation of an intracranial artery. They occur in about 3 to 5% of adults and are usually asymptomatic. The most common sites are found around the arterial bifurcations of the Circle of Willis, particularly the anterior communicating artery, the posterior communicating artery, and the middle cerebral artery. They can also occur at the bifurcations of the internal carotid artery. The significance of cerebral aneurysms lies in their potential to rupture, leading to a subarachnoid hemorrhage, which is a sudden, severe, and extremely painful brain hemorrhage that carries a 40 to 50% mortality rate. Ruptured cerebral aneurysms are the most common cause of non-traumatic subarachnoid hemorrhage. That's why early detection and regular monitoring are crucial to prevent this life-threatening complication. To detect cerebral aneurysms, we typically use three main imaging modalities. First, CT angiography, second, MR angiography, and third, digital subtraction angiography. Each has its own strengths and limitations. CT angiography, or CTA, is widely available, fast, and provides high-resolution vascular detail, making it excellent for screening and emergency settings. However, it involves radiation exposure and requires iodinated contrast, and very small aneurysms, especially those near the skull base, can be difficult to detect because of bone artifacts. MR angiography, or MRA, is non-invasive and doesn't use ionizing radiation, which makes it ideal for follow-up imaging and for patients with contrast allergies. The limitation is that it has a lower spatial resolution than CTA, and flow-related artifacts or motion can make small aneurysms harder to identify. In fact, the sensitivity for aneurysms smaller than 5 mm can be as low as 35%. Digital subtraction angiography, or DSA, remains the gold standard for aneurysm detection because of its superior resolution and its ability to diagnose and guide treatment at the same time. The drawback is that it's invasive, carries a small risk of stroke or vessel injury, and is more time-consuming. Now, when we look at the general limitations, even with these imaging modalities, detection remains challenging. Around 10% of aneurysms are still missed during routine interpretation. And medium-sized aneurysms can be difficult to visualize on maximum intensity projection images due to overlapping vessels. Also, radiologist fatigue from reviewing large numbers of scans can further increase the risk of missed lesions. Because of all of these challenges, AI-based computer-assisted detection tools have been developed to support radiologists in identifying aneurysms more accurately and consistently. To understand how effective these tools really are, I'll go through 4 key studies that have evaluated the role of artificial intelligence in cerebral aneurysm detection. The first study, by Dina al., published in Neuroimaging Clinical in 2025, examined how AI affects both radiologist performance and workflow efficiency when reading time-of-flight MR angiography or TOF MRA scans. TOF MRA is a specific type of MR angiography that doesn't use contrast dye. It visualizes flowing blood as bright and stationary tissue as darker, allowing clear visualization of vessels. It's commonly used to screen for intracranial aneurysms, but can sometimes miss very small aneurysms or create flow-related artifacts, which makes it an interesting area to test AI assistance. In this study, the authors used 460 TOF MRA scans, 360 for training and 100 for testing, and used a 3D UNet model using multi-center data. 2 radiologists, one junior and one senior, reviewed the same 100 test scans with and without AI assistance, and the results were compared. The AI model alone achieved a sensitivity of 74% and a specificity of 95%, with about 1.6 false positives per scan. For the junior radiologist, sensitivity improved slightly from 78% to 83%, though not significantly, while specificity decreased from 93% to 91%. The senior radiologist maintained a consistent sensitivity of 87% and a specificity of 94%, regardless of AI use. Interestingly, Reading time actually increased by around 15 seconds per scan when using AI, and confidence levels remained unchanged. So overall, AI did not significantly improve diagnostic accuracy and even slightly reduce specificity for less experienced readers, while also increasing reading time. This suggests that although AI holds promise, it still requires workflow optimization and clinical validation before being fully integrated into daily radiology practice. The next study is by Dina et al., published in the Journal of Neurointerventional Surgery in 2023. This was a systematic review and meta-analysis that combined data from 43 studies involving over 18,000 patients to assess the diagnostic accuracy of AI algorithms for detecting cerebral aneurysms in CDA, MRA, and DSA. The authors divided the studies into two categories: standalone AI, where the algorithm worked independently, and AI-assisted readers, where radiologists use AI support while interpreting scans. For standalone AI, the pooled sensitivity was about 91%, with an area under the curve of 0.94, but the false positive rate was relatively high, around 16%. For AI-assisted readers, the pooled sensitivity was around 90%, and the false positive rate decreased to about 8%, showing that collaboration between AI and radiologists can help reduce unnecessary alerts. Overall, the analysis showed that AI performance is comparable to that of radiologists, but the authors highlighted several issues. Most studies were retrospective, with high risk of bias and limited external validation. So, the clinical takeaway here is that while AI has strong potential to support radiologists, it's not yet ready for routine use. The authors concluded that AI should function as a decision support tool, rather than a replacement, until large, multi-center, prospective studies confirm consistent real-world performance. The third study I'll talk about is by Hu et al., published in the Lancet Digital Health in 2024. This was a large, multi-center validation study conducted across 27 hospitals in China with over 16,000 CDA scans used to train and test the deep learning model for intracranial aneurysm detection. The study was designed to evaluate how well AI performs compared to radiologists, and whether it can actually improve radiologists' accuracy and efficiency when used as an assistance tool. They tested this in 3 different stages. First, they compared AI alone versus clinicians reading alone. Here, the AI system showed a much higher sensitivity, 94% compared to 66% for clinicians, while maintaining the same specificity around 85%. This means the AI was better at finding aneurysms while keeping false positives low. Second, they tested AI-assisted clinicians, meaning radiologists who used the AI's output as support during interpretation. In this group, diagnostic accuracy significantly improved. The AUC increased from 0.795 to 0.878, and the sensitivity improved from 68% to 86%, while reading time became slightly faster. So, AI actually helped radiologists perform better and read quicker. Finally, they validated the model in real-world clinical settings. Even in routine hospital use, the model maintained strong performance, with AUC improving from 0.787 to 0.909, and sensitivity from 59% to 83%. Overall, this study showed that a deep learning model can reliably detect aneurysms, improve radiologists' performance, and integrate successfully into a clinical workflow as a second reader. The final study I'll discuss is by Zhu et al., published in BMC Medical Imaging in 2024. This was a systematic review that analyzed 47 studies using different types of AI models for intracranial aneurysm detection and segmentation on CDA, MRA, and DSA scans. The studies used 4 main types of AI models: classification models, which determined whether an aneurysm is present or not; detection models, which located the aneurysm within the image; segmentation models, which outlined its exact shape and size; and finally, hybrid models, which combined both detection and segmentation to provide more comprehensive results. In terms of performance, classification models achieved accuracies between 74 and 99%, with sensitivities up to 99%. Detection models had sensitivities between 82 and 94% and specificities up to 96%, showing good localization. Segmentation models performed well too, with DICE scores ranging from 22 to 95% and MIOU scores up to 96%. The DICE score and the MIOU, or mean intersection over union, both measure how closely the AI segmented area matches the radiologist's outline. So, higher values mean the AI is doing a better job at accurately outlining the aneurysm. Finally, hybrid models that combined both approaches achieved balanced performance, with accuracies up to 94% and sensitivities up to 97%. Overall, the review found that deep learning and hybrid models achieved the highest performance, but the lack of standardized data sets, limited interoperability, and few real-world validation studies still prevent AI from being fully integrated into routine clinical practice. So the main takeaway is that AI has shown real promise in improving the detection of cerebral aneurysms. It supports radiologists by enhancing accuracy, reducing missed cases, and improving workflow efficiency. At the same time, every study highlights important limitations, from workflow challenges and false positives to the lack of standardization and real-world validation. While AI clearly enhances detection and efficiency, it's not yet ready for full clinical use. We still need larger standardized studies, better validation, and ongoing training, not only for the models, but also for the clinicians using them. Overall, AI should be viewed as a tool that complements radiologists, providing valuable support in clinical decision-making and patient care. And that concludes my presentation on AI use in cerebral aneurysm detection. Thank you so much for watching.